a sterile technique that has a set of specific practices and procedures performed to make equipments and areas free from all microorganisms and to maintain that sterility. It is often established by using the innermost side of a sterile wrapper or by using a wrapped sterile drape. Its purpose is to ensure the sterile items remain sterile and to protect patients from possible infection when normal body defenses are not intact. Wash hands to prevent transfer of microorganisms. Choose a flat, hard, dry surface and clear sufficient area on which to prepare a sterile field to have plenty of room to work. Before sterilization, objects are wrapped and wrapper when opened provides a sterile field to allow opening without contaminating the contents. Determine the sterility of the package, ensure that the package is dry, check the expiration dates, and look for indications that it has been previously opened. Most package is contaminated that must be discarded. The scrub person drapes an unsterile table by placing the drape over the unsterile surface nearest self first and carefully completing the coverage of the far side. Gloved hands are protected by cuffing a drape over them to facilitate easy placing of drape, and this could also prevent the gown from being in contact with unsterile table when the far side will be the one to cover first. Unfold drape towards self first. When completing the coverage, the rest of the drape is unfolded away from self. Unfolding toward drape first prevents from leaning of the near unfolded drape when the nurse tries to unfold the far side. The scrub person stands back from the unsterile table when draping it, to prevent the gown from touching the unsterile table. Place the package in the center of the work area so that the top flap of the wrapper opens away from you, to prevent subsequent reaching directly over the exposed sterile contents which could contaminate them. Reaching around the package, pinch the first flap on the outside of the wrapper between your thumb and index finger. With some folded packages, it may be necessary to grasp the uppermost flap at each corner. Pull the flap open, laying it flat on the far surface. Touching only the outside of the wrapper maintains the sterility of the inside part of the wrapper. Side flaps are opened one at a time. Opening the top one first, use the right hand for the right flap and the left hand for the left flap. To watch each flap being opened lowers the risk of contamination. Pull the fourth flap towards you by grasping the corner that is turned down. Make sure that the flap does not touch your uniform. If the inner surface touches any unsterile article, it will be contaminated. Hold the package in one hand with the top flap opening away from you. The hands are considered contaminated, and also at no time should they touch the contents of the package. Open the package as described above using the other hand, pulling the corners of the flap well back. Sterility is maintained when sterile objects are placed within a sterile area. If the flap of the package has an unsealed corner, hold the container in one hand and pull back on the flap with the other hand to prevent contamination. If the package has a partially sealed edge, grasp both sides of the edge, one with each hand, and pull apart gently to prevent touching the sterile area with unsterile hands. Rewrap the sterile package as required by reversing the order to unwrapping. Close the proximal flap first to prevent reaching across the sterile field, the side flaps next, and the distal part last, to prevent reaching across the sterile field and possible contamination. Hold wrapped item in the dominant hand, with top flap opening away from the body. With other hand, reach around the package and unfold top flap and both sides, to prevent touching the inside surface of the wrapped item. Keep a secure hold on the item through the wrapper with the dominant hand. Grasp the remaining flap of the wrapper closest to the body, taking care not to touch the inner surface of the wrapper or the item. Pull the flap back towards the wrist so the wrapper covers the hand and wrist. This would expose the item inside the wrapper, taking into account not to touch the surface of the wrapper or the item. Grasp all the corners of the wrapper together with the non-dominant hand and pull back towards wrist, covering hand and wrist. Hold in place. To hold the wrapped item steadily, hold the item 6 inches above the surface of the sterile field and drop onto the field. Be careful to avoid touching the surface or other items or dropping onto the 1-inch border. Dropping the item into sterile field prevents the hands from touching the item accidentally. Hold package in one hand, pull back top cover with other hand, alternately carefully peel the edges apart using both hands. This would expose the package freely. After top cover or edges are partially separated, hold the item 6 inches above the surface of the sterile field. Continue opening the package and drop the item onto the field. Be careful to avoid touching the surface or other items or dropping onto the 1-inch border. At a height of 6 inches, the outside of the package is not likely to touch and contaminate the sterile field. Discard wrapper for cleanliness purposes. Before pouring any liquid, read the label, name of the solution 3 times to make sure you have the correct solution, to avoid error by using the wrong solution. Open solution container according to directions and place cap on table away from the field with edges up, to avoid introducing microorganisms inside the cup when it is turned down. Hold the bottle so that the label is uppermost, to prevent the solution from dripping down into the label. Hold the bottle of liquid at a height of 10 to 15 cm over the bowl and to the side of the sterile field so that as little of the bottle as possible is over the field. The tip of the bottle should never touch a sterile container or field. The tip can contaminate the sterile bowl if it has touched the bowl. If the bottle had been previously opened, pour small amount of liquid into a waste receptacle without letting the tip of the bottle to touch receptacle. Carefully pour the solution onto a sterile container in the sterile field so as not to splash the liquid. Any moisture will contaminate the field. Replace the lid securely on the bottle if you plan to use it again. Touch only the outside of the lid when recapping. Label the solution with date and time of opening to maintain sterility. Keep the tip of wet forceps lower than the wrist at all times. Forceps from flowing to the handles and later back to the tip, making the forceps contaminated. Hold sterile forceps above waist level. There is less danger of contaminated if the forceps are held near to eye level. Hold sterile forceps within sight to prevent contamination. When using forceps to lift sterile supplies out of a commercially prepared package, be sure that the forceps do not touch the edges or outside of the package to maintain sterility. When the handle of the forceps were in contact with the bare hands, position the handles outside the sterile area. To handle the forceps harbor microorganisms from the bare hand. Deposit a sterile item on a sterile field without permitting moist from forceps to touch the sterile field. Barriers drapes prevent a sterile field from becoming unsterile when the drape becomes wet. Discard disposable forceps after use or send reusable forceps for repacking and sterilization or immersing them in a solution to maintain sterility of forceps and equipment.